Now, Andrew, we've been talking about how hard it has been to sleep in recent nights given the heat, but
in
of course,
particular.
Snoring is also one of those common causes of lack of sleep, and also fights and frustrations in households. But it might also be a symptom of a more insidious condition, sleep apnea, that leads to long pauses in breathing during sleep.
Well, it is normal for healthy adults to have up to 5 pauses every hour, but some people have many more, and it can be a serious health risk. To tell us more about sleep apnea, we're joined by Dr. Jason Amatoury from the Sleep Health Foundation. Jason, welcome.
Good morning.
Good morning.
So just how common is this condition? We hear that many people do suffer from it, and I guess for partners of those who suffer from it, it can be quite disturbing because they're worried that they're actually not going to breathe at all.
Yeah, that's right. So about 5% of Australians suffer from sleep apnea, but it can get anywhere up to 50% of the population has been rated that has at least some severe snoring or apnea events. And indeed, like most partners, are being quite annoyed by the snoring sound. I mean, that's the one thing they indeed notice, that loud snoring vibration that keeps them awake during the night, but they don't think much of it really. It's just that it's loud and annoying, but definitely it's common.
But sleep apnea is something more than just snoring,
That's
isn't
right.
it?
So usually if you have sleep apnea, you definitely will have snoring along with it. But sleep apnea occurs when that upper airway, so that's that throat region, closes off during the night when you sleep and stops air getting in and out of the lungs. And as you can imagine, that isn't a very good thing, and the body doesn't like that at all. So
And so there are actually 2 types of sleep apnea. You've got that obstructive sleep apnea that you talk about where it closes off, but there's also central sleep apnea. What's that?
So obstructive sleep apneas occur when the upper airway closes, but you're still trying to breathe against that closed airway. So we don't stop our effort to breathe. While central sleep apnea is where that your effort to breathe actually stops entirely. So it's not just something that's caused by the upper airway, it's caused by other physiological factors that limit you from breathing altogether.
Such as what?
There are a number of things that can relate to this. So anything to do with your CO2 regulation and oxygen regulation in the body. So there's still a lot of research going on in this area at the moment, and we're finding out more and more as we go.
Do we understand as well about what triggers sleep apnea in people? Is it something that can be attributed to other conditions? Is it more common, for instance, in certain age groups or in men or women?
Definitely more common in men and in middle-aged group men. The biggest factor is obesity. So if you have a bit more weight on you, you tend to put more weight around the neck, which compresses the airway and causes you to obstruct during your sleep. But there are a whole lot of complex factors that actually go into it. One of them is also craniofacial, so your skeletal structure, so how your bone structure is arranged, and the amount of tissue within that bone structure is what also causes the airway to collapse. But there are a number of conditions that could be contributing.
Potentially also drug abuse, or if you may be on some medication, that has some effect?
Yeah, different medications. So apart from your airway being small, because, from anatomical factors, but your muscles relaxing during sleep is a major cause for it. So anything that triggers making your airway smaller or making your muscles relax more than they should will also contribute to your airway collapsing and having sleep apnea.
Now, I imagine that it may also be a factor in affecting other types of health conditions. I've read that it may, in fact, actually cause greater prevalence of certain conditions.
Yes, most definitely. So it's associated with a lot of serious comorbidities, so cardiovascular disease, heart attacks, stroke, high blood pressure, diabetes. Another one that people aren't too aware of. They think they're tired during the day, maybe from just being overworked or what have you, but definitely causes some excessive daytime sleepiness in many people.
Which, of course, can be a danger, particularly if you're operating machinery or driving. There are instances of people falling asleep.
That's right, so people with sleep apnea are at higher risk for car and industrial accidents.
So I guess the question is, if you have it, can you solve the problem? How do you treat it?
Yeah, luckily there are a number of treatments. So the first line treatment is something known as CPAP, or continuous positive airway pressure, which simply involves wearing a mask on your nose or maybe some nasal pillows in it or around your face.
So that's actually forcing the air down your throat?
Yeah, so it pressurises the air to open it up and keep it open. So it's connected to a machine, essentially a blower, that a pressure is set that's prescribed for you, and enough to keep that airway open while you sleep.
Once again, we talk about how disturbing it is for a partner. I guess that's not great, having a machine there at the same time. Yet, health-wise, it's obviously much better.
Definitely. There's a lot of benefits to it. And also second-line treatment. So for those that can't tolerate that CPAP machine, there are other options out there that they can seek.
Can people actually reverse the condition? Are there things that people can do to perhaps reduce its severity?
I mean, there are lifestyle factors. So reducing weight may help reduce the severity, but there's no real complete cure at the moment. So there are treatments, but no real way to bring it back to normal.
And surgery is an option for some people.
There is. It's usually a last resort because it's quite invasive and it can cause complications, and so they're not always entirely successful. So it's better to start off with the simpler treatment, so going from CPAP, or another one known as mandibular advancement splints. It's like wearing a mouth guard that pulls your jaw slightly forward to enlarge the airway. So trying out these other medical treatments first before going into the surgical path is probably recommended.
Yeah, I mean, you mentioned that, and I think anyone who may suffer from it would trawl the internet and see what solutions are out there. I guess you would warn to be careful, because there are some treatments that are recommended supposedly that may not be that fantastic.
That's right. So the best thing to do is go to your GP and get referred to a sleep and respiratory specialist who will best diagnose and best be able to treat you with the right form of therapy for you.
Now, sleep apnea, obviously this is something that's happening while you're asleep. If you don't happen to have someone who, for instance, is keeping an eye on you during that process, how do you know whether or not this might be an issue for you?
Yeah, unfortunately it's very difficult. So it's usually the bed partner who recognises that their partner is snoring, or they see them stop breathing during their sleep. I guess if you're excessively tired during the day, that's one thing you should consider. But unfortunately there's not too many other factors. If you can't really feel that you've got an issue during the day, unless someone's going to tell you, it's going to be very hard to get diagnosed. This is why a lot of this disorder goes undiagnosed for many years.
But would there be a point in your sleeping patterns during the night where it would wake you up to the fact that you're not getting oxygen, and your body sends off that alarm and it wakes you up because essentially you're dying for a breath?
Yeah, well, sometimes that does occur where the subject or the patient actually does wake up from that choking, but many other times they don't. So the brain actually does send a signal, like a brief awakening period that you're not aware of, to stimulate the muscles so your airway opens, but more than likely you're not going to be aware of those situations.
So just how severe, I mean, we talk about, you know, your partner being worried about you while you're sleeping, but just how bad could an episode be, for instance?
Okay, well, they can last from anywhere between 10 seconds to 90 seconds, so where you're not breathing, and occur from 5 to over 100 times per hour in severe cases, so it can be quite detrimental.
Okay, then, yeah, we definitely want to do something about that.
Definitely.
Dr. Jason Amatoury, wonderful to have you with us. Thank you very much for
having
joining
me.
us.
Thank you.